And I have a weird overlay. Cool. Main camera. Wonder if this will work. Hello, can you hear me now? Iris Bear asked if it's working now. I don't know why it's not popping up properly. Did that chat pop up, or are you just seeing this weird bottom of screen situation? Oh, you can hear the sound and everything? Oh my gosh. Oh my gosh. Give me a second. Well, there is a weird bottom situation. Interesting. Interesting. If I go back to main, why? Turn off the chat. There we go. Maybe this will work now. All right, let's find out. There is a weird bottom situation. Do you see that? Oh, I don't know why it's doing that, but we'll see. Okay. Oh, and my lights went out in the background. Everything's chaos. I know how to do this. Oh, looks great and sounds great now. Well, if anybody, it looks like some of you found this. This was very stressful, and I would prefer not to have this happen again. Love it for me. Office, great, lovely. Now, I wonder what happens if I put it on the iPad. Why is it displaying that? What is happening? Everything is broken. Okay, so, hello, welcome if you found this accidental secret live stream after I had a completely failed live stream. So, essentially what happened was that I am alone today and I am running the stream myself, and I have these lovely handwritten instructions that we did between Aaron and I, who normally runs the stream. And I have run a stream by myself, but never when Aaron was in a foreign country and therefore completely inaccessible to me. And one of the pieces that I use for the live stream is this chat thing that Aaron has. And that chat thing, unfortunately, is like broken. So it was breaking the ATEM many, and it was doing weird things, like causing me to have just like completely strange things on the screen, like what I'm watching on Netflix, and I have no idea why. So, will you all put things in the chat if you're here, just so that we know? This has been very chaotic. Also, I appear to not be able to share my iPad, which is really gonna kind of negate the entirety of the point of this whole thing. So we're just gonna restart my entire iPad and figure out what's happening with that. Who knows? Oh, we're back. Okay, you all found it. Well, now I'm completely stressed about what to do. How are other people doing? We have 2 donuts today, which I feel like I am definitely going to need. I'm glad that you all seem to make it over here. As far as I can tell, I made the right call. I think the only thing I could have done was kill that stream and start a new one. Rural says, I am here. I had to go to your main channel and find the new stream. Well, thank you all for endeavoring to find it. Was extremely stressful. Do not recommend. Don't enjoy running streams all by myself. Not fun. Don't want to do it again. The good news is that we have 2 donuts today, so that will make up for it, at least in part. Both of which look amazing. The other reason we have 2 donuts, well, we mainly have 2 donuts because there are too many flavors and they are only around for a month and I want to try them. But the other reason we have 2 donuts is that we are supposed to be talking about healthcare, although we may just be talking about how Lily can't run a live stream by herself. Erin is in Germany, therefore asleep right now because it's like 2:30 in the morning. So, yeah, we're pretty much the secret channel. You all finding this means that you've done an excellent job because, truly you are doing technically better than I am doing at this. I don't appear to be able to, in any way put the chat on the screen. Well, now I'm tempted again to see what I can do. Yeah, it just doesn't seem to be working quite the way that I want it to. I think the overlay is just like legit broken. So it's fine. Yeah, the overlay is just broken today, unfortunately. So that's okay. But it is pretty cool if it did work, but it doesn't seem to work. How are people doing? Let me introduce the donuts. I do not have someone to adjust the donut cam for me today, so these might not be as in focus as normal. This donut, I mean, look at this donut. This is a Fluffernutter donut. And I don't even know what all it has going on. It's got like peanut brittle or something on the top, and then cream, and then banana, and it goes all the way, the cream goes all the way through. This donut is lush, but let me show you the other one. This is a creme brulee vegan donut, and maybe it looks more beautiful in person than I'm possibly going to be able to convey on camera, but it is gorgeous. And it's like a totally filled donut. So yeah, we've got 2 really great donuts. Dean says, you know what, folks? Streaming is hard. True facts. It's really true. It looks like a Baby Bell cheese. It does kind of look like a Baby Bell cheese. Oh man, I'm so sorry that I'm so sorry that everything was so stressful for the beginning, because now I really don't want to talk about healthcare, but we have lots of things doing. Craig says, looks like you had a default view of Apple TV instead of iPad up a moment ago. You may need to restart AirPlay from iPad to send to Apple TV. It's like so many more levels than that, but I appreciate your input. Actually, that was the chat, not the iPad, and that was being Chromecast. So it was essentially a Mac Mini that I am Chromecasting to have hooked up to the ATEM. Unfortunately, the wonderful little browser extension that Erin installed for me, that Erin built, and you can get on Chrome yourself, appears to be legit broken. I don't know if it's just not interacting well with another thing on my Chrome, because I have used it before and it's been fine. But, yep, I'm not going to be able to do chat from that, but at least we got the mic working, because I can do live streams without chat, like just reading the chat, but I cannot do live streams in any way, shape, or form without, without a mic. So there's so much going on. Yeah, so let's actually see if I can get this to properly screencast. Yes. It does look like I can now. Hey, does that actually look correct? Hey, Aaron, why are you awake? Aaron says, we tested this before I left. Aaron, why are you awake? Well, okay, I don't really know exactly why it didn't work, but it is super broken, Aaron. But we did test it before you left. You did all of the good work, but I don't really know why. Aaron should be asleep. Everyone tell Aaron to go to sleep. It is, I think, 2 a.m. there. It's very confusing because daylight savings time just happened here. So you should be asleep, Aaron. Take some melatonin if you're not asleep. Rural says, I am annoyed with U.S. healthcare. My open enrollment just ended, so I set up, but Anthem has dragged feet for 2 weeks on whether or not I actually need an MRI to know if I have a brain tumor. I probably don't have a tumor. Sadly, also have no donuts. Well, I'm more excited about you having no tumor than you having no donuts, but I would like you to have some donuts. I wish that you all could see, if I had a cat cam right now, there is a small slip of paper that is on the floor of the kitchen, and Miss Dora has decided that she needs to do pounce attacks on all of it. Rural, I really hope that you can get checked out and seen to make sure that your brain is okay. Aaron says, it is 2 a.m, but everyone was very excited to hang out at the hotel bar. Well, hopefully they weren't trying to watch my live stream about American health insurance. Rural says, I just want a damn MRI. I agree. I understand. The frustration of waiting for things, especially diagnostic things, can be really stressful. Although that is not a US specific thing. That is a thing in pretty much all healthcare in the world. So you'd probably be even more likely to have a slightly longer wait for diagnostic MRIs if you were on a single payer system. That is not a uniquely American problem, interestingly enough. But I really hope it is not, and that you get it approved for peace of mind, no pun intended. Dean, is that your attempt at making a German sentence? Der sleeping Funkelschat? What was it? What is that supposed to be? Crystal Sky said, I got billed $130 2 months ago after my appointment because my insurance refused to pay it. Stupid healthcare system. My insurance doesn't even pay for what it says it does. Hello. Okay, there's certain things that we cannot fix about American health insurance, and that you cannot predict or figure out what you were doing when it comes to enrolling in a plan. But hopefully we can at least prevent the getting enrolled in a plan and thinking it covers something and then it doesn't. That being said, exactly what Crystal Sky is talking about is extremely common, and there's only so much you can do to kind of prevent that with some, defensive action, which I think defense is extremely important when it comes to the American healthcare system. There are options. You can always have the right to appeal if you do believe that your insurance should be covering something. You always have the right to negotiate down with the original provider. You can say, hey, this provider visit my insurance was supposed to cover. You clearly didn't do a good job enough of billing. I have like cat hair stuck to my lips. You can tell the provider, hello, you didn't do a good enough job of coding this in order to get covered by my insurance, even though we thought it was going to get covered. So what I would like you to do is do a write-off for whatever the portion that they didn't cover. And a write-off would be a provider write-off, which essentially says they won't charge you any more than what they got paid by the insurance. If the insurance didn't cover it at all, then another thing that you can do is appeal directly to your insurance to say, hey, this should have been provider covered. An incredibly common thing that we see in, trying to figure out health insurance bills is that things are just coded wrong, and or they get overlooked in the first place. Like, things will be coded one way and then the insurance will reject it, and you have to go back and go, no, actually, I got this test for a completely preventative reason. Iris Bear says, some providers are good at working with you on payment issues like that. Here's the thing. medical bills don't show up on your credit score anymore. 2, they have to work with you if you refuse to pay them until they figure it out, right? So like some providers are a lot more proactive at being like, hello, I'm going to try to bill your insurance again. Don't worry about it if you get an EOB. Some other places you can call back and be like, hello, I was told this was covered. You know, a great example is I'm going in for occupational therapy appointments like every other week right now. Those are billed to my insurance at $250 an hour. A lot of people do not realize that like if something gets classed as OT versus PT, that can influence, which is occupational therapy versus physical therapy, that can influence what your coinsurance is. But a great example of this is like every time I walk into the OT, they say, hello, your estimated copay is $40. And I say, no, I have no estimated copay because I've already hit my out-of-pocket maximum for the year. And they go, oh, okay, we'll just bill your insurance then. So Rural says, whoa, wait, not on credit score at all. No, medical bills do no longer show up on your credit score. This has been true now for 4 years. A lot of times medical bills, that they cannot affect your credit score anymore, Iris. They will show up on your report, but they cannot affect your score. And that has been true now for 4 years, I believe. The big issue, though, is there is a lot of people that have medical things that do show up and affect their credit score, despite the fact that they, you know, are medically related, which is a lot of people will end up getting things like care credit cards, which are essentially low interest credit cards, they also might have, you know, they have a major medical event and they put their everyday bills, or they feel pressured by a provider, and so they put it on a regular credit card. Those are all instances in which things that are medical costs, like most medical bankruptcies in this country, are not just from medical care. They are from trying to cover the cost of living and dealing with other increases in cost in your life while going through a major medical event. Like when we actually look at medical bankruptcies, it's an all-around thing. But medical bills that are on collections will appear on your report. Charge-offs won't anymore that are medically related, and they cannot affect your credit score as of 4 years ago. You may have grandfathered old influences on your credit score, but it is one of these huge things that has made it has made a huge difference, because that was like, I mean, I don't think it's perfect by any stretch. I wish that we weren't in the situation where people where people can't afford to pay for their medical bills and declare medical bankruptcy, because, you know, it doesn't solve any of it. Dean says, I am just stunned that anything medical was on a credit report. Welcome to America. So yeah, and I mean, they'll still end up on your report, but they won't end up on your score. Our credit system is definitely different here than they are in, it's different. It's based on very different things. There's things that are and aren't included here that, so yeah, it's just very different. Why am I having all these iPad issues? Interesting. Okay, now it looks like it is. All right, should we jump into this? And then we're going to do like this. Rural says, well, okay, I'll keep this latest MRI appointment and let them duke it out amongst themselves. Yes, I think duking it out amongst themselves is good, but I will also note that please get it pre-authorized if that's what you're waiting on. You usually have the right to get your pre-authorization responded to within 72 hours. So if you are aiming to get something pre-authorized, if that's what you need from your insurance provider, quite often your rights are to get the response to the pre-authorization within 72 hours. And it's even more for that. So Dean says, I mean, just the phrase medical bankruptcy chills. Hello, welcome to the #1 cause of bankruptcy in the United States. Don't we love America? All right, let's jump in. Well, let's start, because I already just spewed off a ton of stuff. The first thing I want to say is I think anybody who has any degree of inkling about the system agrees that the American system is wrong. It's broken. we all might disagree on what things need to be fixed. You might be like me and think so many things need to be fixed that you actually need to burn it down and start over. That being said, there are a lot of things that are helpful to know about navigating the American health insurance landscape, even if we are working to overhaul it. American health insurance is frustrating, and it can feel like you are literally learning calculus in order to try to figure it all out. The good news is that while it is a test that unfortunately you have to continuously engage in with the United States, there are a ton of things, especially just for 2021 and 2022, that do make it a little less stressful, a little less hard of a decision. A lot of the gaps, it's in the ACA coverage in marketplace plans have been filled temporarily by the American Rescue Plan, which was Biden's third COVID care relief package, essentially made a lot of temporary changes to the health insurance structure in this country. So I am going to start from the very beginning because I have run into the problem where a lot of people literally maybe they have only ever had one option through work. Maybe they've always been on their folks insurance. Maybe they've, never really had a lot of choice in their health insurance plan, or they've never had one before. And it seems like kind of starting at the basis will help. Rural says pre-authorization is what I need, and it's been way more than 72 hours. And if it is a tumor, it's fast growing, so I need to know ASAP. You should look at what your rights are with regard to pre-authorization, because that should be stated on your plan documents, which we'll get into a little bit sooner. But there are limits on what they are able to do. My rights were that I had to get pre-authorizations handled within 72 hours. And a lot of people do not realize that is within their right. So you can fight them. All right. Can we actually see this on the screen? Can we see it? We can see me in the dot. Here we are. Look at this. Look at this. I love when we can actually effectively do this thing. So, navigating the bull that is American healthcare open enrollment. So, step one is to understand your entire options. So, I put tons of cats in here, by the way, because I am trying to make this a little more palatable because this is boring and terrible for everyone. Where can you get health insurance? Your first step is your employer. If you work for a regular W-2 employer, that is your first step, because if they are of a certain size and you work more than 30 hours a week, they are required to offer you health insurance. That being said, you may not fall into that category. 2, your spouse or domestic partner's employer insurance. So if you are married to someone, then they may have spousal or domestic partner coverage through their employer insurance. 3rd is healthcare.gov or your state exchange. Healthcare.gov is what covers most of the states. However, depending on your state, they may have a branded state like Kentucky Cares or something like that. A state portal. These are all the ACA or Obamacare plans. ACA and Obamacare are just synonyms. They stand for the Affordable Care Act or Obamacare. This is the next place you're going to go. If your income is below around 150% of federal poverty level, so quite low, then you may qualify for Medicaid. This is also a different thing that exists in different states. I am talking about here people under the age of 65, simply because in the United States, you do have access to Medicare when you turn 65. And that is a whole different ballgame, which is an important ballgame because it's not just automatic. There's stuff you have to do with Medicare, but we're not going to get into it on this one. If you are low income, look into Medicaid. It is the closest thing we have to single payer coverage in this country, I would say. So there are a lot of advantages. It usually has a state name for it. It's usually not called Medicaid. In Oregon, it's called Oregon Health Plan. So have a look at it. I think it's called like the Washington Apple or something like that, Apple Care. It has a different kind of name in each state. Other possible options, trade groups. If you're part of something like the musicians union, the freelancers union, they may have negotiated for a group plan or group plans. So essentially you get kind of the benefits that you would get through the employer plan. Cobra is a kind of stopgap solution along with short-term plans. Short-term plans are coverage for less than a year. And Cobra is when you lose your health insurance through your job and you were previously getting it, for 104% of your premium, you are able to continue that insurance. Usually it makes more sense to enroll in a healthcare.gov plan if you lose insurance through your job. However, there is a exception to that case. And that exception is if you are, one, I guess, if Cobra is being paid for by your employer, which is quite normal, or two, you've already like hit your out-of-pocket maximum and your deductible on your plan. If you have hit your out-of-pocket maximum and your deductible on your plan already at that point, then there can be big advantages to staying on your employer plan through the end of your plan year, because it might be less than the cost of premiums and hitting a new one on a new plan. When can you enroll? You cannot enroll anytime. So most plans have what's called an open enrollment period. You'll probably hear the HR people at your job, if you have a traditional job, shout about it. If you do not have access to employer coverage, then the ACA open enrollment started on Monday, which was November 1st, and it goes through January 15th. However, if you want coverage for January 1st, you need to enroll by December 15th. It's a longer open enrollment plan than we had under Trump. The open enrollment period was shortened under Trump, and they've extended it as part of the American Rescue Plan. So your final deadline to get health insurance through the ACA, mostly for through the marketplace, is January 15th, and that coverage would start on February 1st. But last but not least is these magic things called change of life status, and these trigger your own personal special enrollment period. And these are really, really important because it's much more broad than you might think. Open enrollment is like when you have the chance to pick a new plan. You don't need any of these special things to happen to you, and you can switch plans at work, find a new plan on the exchange, any of those things. But if you have a change of life status, then you can usually get insurance within 60 days of that change. It does vary by where. For example, it might be a shorter period if you want to get covered under your spouse's workplace plan because you lost insurance. It might be within 30 days or something like that. So what is a change of life? First, you lose insurance. So if you leave your job, it can be voluntary or involuntary, but if you leave your job and you lose employer coverage, that would be losing insurance. If your hours drop below 30 at your job and you no longer qualify for health insurance, then that would be losing health insurance. If you turn 26 and you get kicked off your parents' plan, then you also would count as losing health insurance. If you no longer qualify for Medicaid, Medicare because your income has gone too high, I don't know why I struggled with that word, then that would put you over the line. Or something like CHIP, Children's Health Insurance Plan. You have a change in household. So if you get married or get divorced, you have a death in your household, or you have a child or adopt a child, those all trigger a change in household. If you move to a new zip code or county, if you move into permanent housing from transitional or shelter housing, even if you don't change zip codes, if you move out of something classed as transitional or shelter housing into permanent housing, that triggers a move. Or if you're a student and you're going to school, or you're a seasonal worker and you're changing to wherever you do seasonal work, that all qualifies as a change of life. And then there's other specific changes like beginning or leaving AmeriCorps, which I'm very jealous of because the ACA happened after I left AmeriCorps and I just didn't have any health insurance while I served the federal government for 2 years. If you leave incarceration, that automatically triggers a special enrollment period. If you acquire U.S. citizenship or if you get tribal status with one of the tribes that has universal health care, you also might have a change of life status. So here's the question. Should you actually get a healthcare.gov plan? There's other options out there. You might have heard of the faith-sharing ministries, any of those things. Here's the big thing. If you have access to healthcare from your employer or your spouse's employer, this isn't true if you are not legally married, but your domestic partner could cover you. If you're not legally married, but your domestic partner could cover you because their workplace plan covers domestic partners, you are not obligated to do this. But if you have access to it through your employer or your spouse's employer, unless that is considered unaffordable to you, then you will not get subsidies on the exchange. And this is one thing that was not fixed under the American Rescue Plan. So there is something that is called essentially the family whole, I like to call it the family vortex, which is, let's say your spouse has coverage through work and it's totally free for them or it's affordable for them. Let's say they pay $100 a month and they make $3,000 a month. And that's considered affordable. It's below 9.83% of your household income. So it's affordable for them. But they can cover you as their legal spouse through their workplace plan. But the cost for adding dependents, could be your kids, could be you, is like $800 a month. And that is not affordable. That is greater than 9.83% of household income, right? Because that's an outrageous amount. But that doesn't have to be affordable. It's just based on how much it costs for them to get covered. So this is one of the areas where you can get really screwed. So if you are if you have access to employer coverage and it is considered unaffordable based on this test, or you can get covered under your spousal income and theirs is considered affordable, then you do not qualify for subsidies on healthcare.gov. You are one of the only people that doesn't qualify for subsidies because the subsidies during 2021 and 2022 are available to everyone regardless of income, and they make your costs lower. So if you do qualify for your spouse's employer insurance and it is too expensive, like for example, it's $800 a month to cover you, you can still enroll in a healthcare.gov plan. You just will not get access to the healthcare.gov premium subsidies, which really do help a lot. If you don't have health insurance through your employer or your spouse's employer, almost always healthcare.gov is going to be the best way to go because of all of the subsidies available. So there's reasons why you might be like, oh, I want to go shop and try to find a broker and buy it on my own, or I want to get a short-term plan. There are so many subsidies available, especially this year, that are not reliant on your income, that it makes a lot more sense to go through healthcare.gov for majority of people. There are exceptions to that. Crystal Sky says, finding health care is so confusing. Thanks for putting this info together. It is so confusing. I tried to make this simple, and I realized just how much there was to cover, and I feel like it got a lot less simple. Okay, if there's a special category for you if you are under 30 years old. So if you're under 30 and you do not have a lot of healthcare needs, then first of all, if you're under 26, you can be on your parents' plan. So if your parents have a good plan, or they get their health insurance through the exchange, you are legally, they are mandated to offer coverage through you up till you're 26. This was a thing that passed when I was 25 and a half. And so I got 6 months of coverage or something like that on my parents' plan. And I promptly broke my wrist. So real grateful for that. If you are under 30, you can get a catastrophic plan. So this is only available to people under the age of 30 on healthcare.gov. Catastrophic plans, essentially, they still have all of the mandatory provisions required for healthcare.gov plans, which we'll get into a bit more. That's true for all ACA plans. But the catastrophic plans are extremely helpful because they essentially, like, if you don't have a lot of health insurance needs, the premium might be super, super low. It might be like $100 a month. It might be $50 a month. But it still has an out-of-pocket maximum. So it's there for that, like, you are zoo bombing, aka riding a children's bike down a really big hill at 2 a.m., a thing I used to do in my early 20s when I didn't have health insurance, and you get into a crash. Catastrophic coverage is there to prevent you from going completely medically bankrupt. Okay, so cool. We know that that we want to get health insurance, and we have a basic idea of where we're going to get it from, but how do you actually enroll in it? Well, you have to figure out what plans you actually have access to. So if you are someone that does not get access to insurance through healthcare or through your employer, then you would log into healthcare.gov. If you live in a state that has a different state exchange, if you go to healthcare.gov and select your state, it'll point you to that state's page. I'm going to keep referring to healthcare.gov, even though it might be for you a special website like OregonCares.com or something. They all function in pretty much the same way. Or you go onto your employer portal. If you have HR people at work, something I've never really had, but whoever plays HR at your job, they will probably bug you day in and day out being like, it's open enrollment. It's open enrollment now. Here is the thing. Open enrollment periods are often extremely short. They are sometimes only like a week long. So it is super important to actually, as soon as you get that notification that open enrollment is going on, go look at the plans you have available. Occasionally, they'll give you a preview and tell you about what the plans are, but you usually have a really small window. And that window might even be only like 3 days long to pick a plan. You'll have, usually through most employers, you'll have a lot fewer options than you would through healthcare.gov. Like at healthcare.gov, I have like 45 options of different health insurance plans to evaluate, but with my employer, I had 2. So, it's definitely very different. Rachel says, our HR is doing that right now. My open enrollment is November 1st through 15th. I used to work a temp job for a company that all they do is essentially they act as the subcontractors that bug you on behalf of your employer about the fact that you need to do healthcare open enrollment. And they try to push you through different plans. So here's an example of what the different options might look like. They might have different names for the plans, but here's what I want you to know. If you get one of these documents or even something that looks like even less information on it, there is still an actual name for that plan, and you have to be able to find the legal plan documents. The legal plan documents have a lot more stuff that's very, very helpful on them. So, these might try to sum things up, but often doing the research for you is going to require more than this form, this little like table right here. This is a pretty good table. I appreciate their color scheme. It matches kind of my color scheme. But this is kind of the basic overview of what one of these might look like. It'll show you 3 different plans. It might call it the gold, the bronze, the Hdhp. They might have different cutesy names for them, but they do have a legal plan ID. So this is important because you can go look things up even if your portal doesn't have it in it. So there are a couple basic things of what it looks like, and I'm going to show you the example from healthcare.gov, but this also applies to all of these terms are going to be the same on your employer plan. So your estimated monthly premium, that is how much you pay per month. If you have an employer-based plan, you will have a individual premium cost, and there might be a percentage that your employer covers. For some employers, they might cover 100% of the premium. up to a certain amount. So for example, I have a $0 premium plan to me, and the total cost is, I believe, $323 to my employer each month. If I had chosen to go with a higher premium cost plan, I would have had to pay a small portion of that, but I would have had a lower deductible. Premium is how much comes out of your pocket every month, no matter how much of the healthcare you use. So even if you never use your health insurance, you will be paying that. If it is an employer plan, they will be paying it, and whatever is your portion will come out of your paycheck normally. That is tax deductible for you, so you don't pay FICA taxes on that amount. Essentially, it just quietly comes out of your paycheck. So, there are a couple things you want to look for. You want to look for the type of plan. This is a EPO. We'll get into what those type of plans look later. You'll want to look at, these are the really big numbers that you want to look at. You want to see the deductible and the out-of-pocket maximum. So this is a high deductible plan here. This is actually technically almost a catastrophic plan. The deductible is $8,700 a month. And that means that, or $8,700 a year, not a month. That means that is how much I pay for any services to which deductible are applied before my insurance even kicks in. But my out-of-pocket maximum is also $8,700. So out-of-pocket maximum means that once I've paid $8,700 of my own money, then I can't pay any more during that plan year. And this can be extremely important in calculating out your stop loss. An important thing to know is almost all plans have almost no out-of-network coverage anymore. There are still some really nice plans out there that have out-of-network coverage, but usually out-of-network coverage only occurs if you have an emergency. That being said, the ACA means that if you do have emergency services, so you get in a car crash, you need emergency care, then it has to be charged the same as in-network coverage. So emergency care has to be the same as though it was in-network coverage, even if you are out of network. So if you get into a crash in a different state and there are no in-network providers and you get taken to the hospital, that has to be covered as though it is in-network. So this is a super important part of it here. As you can see, I'm on this drug called Enbrel. Enbrel is extremely expensive. And because of that, so Enbrel's monthly cost is $7,800. It's actually, I think, gone up. I think it's close to $10,000 is how much it gets billed to per month, not per year. And this is extremely important to me. So this is a really cool thing that you can use. You can use add your doctors or facilities or add your medication. And on healthcare.gov, it will show you whether or not you have coverage for those. I don't know if you all can hear that, but my upstairs neighbor is having like a bowling dancing party or something like that right now. You will also see this thing that down here that says plan features, adult dental, child dental. Adult dental is almost never covered under an ACA plan. Dental is usually separate. It's not regulated by the ACA for adults. It is for children. But they're almost entirely different. Fuzzbubble says, for my employee healthcare, my prescription costs don't count towards my deductible. Is that normal? Sometimes you will have a different deductible for prescription care. Isn't it great? But it will count towards your out-of-pocket maximum. They can't make that exclude that as long as it's covered. So yeah, it should, what you pay can count towards a prescription deductible. You might have a separate deductible for prescription. So yeah. Correct. Drugs covered, not covered is very important. And then you also get kind of this basic view of generic drugs, specialist doctor, primary doctor, how much it would cost. But I do want you to note that there are certain visits with your primary care doctor that are automatically covered under an ACA plan for $0 and the deductible does not apply. So this is important for you to kind of know and remember. Okay, So these are really easy to find if you go into the plan summary on healthcare.gov. They can be harder to find with an employer plan. But all of these documents, summary of benefit, plan brochure, provider directory, and list of covered drugs, which is also called the formulary, weird word, those are all available even for your employer plans, unless you happen to work for an employer that's large enough, they're self-insured. That's a little beyond the scope of this, but we could talk a little bit about that if you have questions about it. There are some things that don't apply to self-insured employers. Those are really large employers. So, Fuzzbubble says, makes sense, thanks. I mean, it doesn't really make sense that they're allowed to have 2 separate deductibles, but yeah. Okay, so if you aren't on the ACA, like if you're not on healthcare.gov, how do you find these documents? So plan documents for workplace plans, they may have them in your portal when you sign up. They might have the plan document. Plan documents contain so much more information than the tiny little thing that they're going to give you or the slide that they're going to put up in the little presentation. You can also search the formulary. Almost all the formularies you can find by just finding the name of the plan. Like it might be, for example, mine is Providence PPO Hdhp 720 or something like that. Or it might have a plan code. Search for that, and then the word formulary, and on the provider's website you can find it. Quite often you can dynamically search them, but otherwise you may have to pull up a huge PDF and just search for them. It is important to understand that if you are looking to see if a provider is covered, like you're searching on the provider's website to see if they are covered under your plan, you're trying to find out if your doctor is covered, your rheumatologist, your, the place where you get your colonoscopies, whatever it might be, if you're trying to make sure they are covered, please note that mental health care and certain kinds of treatment providers like acupuncture or massage therapy, or even something like occupational therapy, may be listed under a different set of providers, and they may not count as regular provider copays. So just because your specialist copay is $100 does not mean your mental health care copay is going to be $100. So you do want to check the plan documents, and you might want to look to see if there's multiple places to search, because it's quite normal to have a second place to have providers for mental health providers. Rural says, Joy, mine is self-insured. Yeah, I believe you work for a public agency, so self-insured public agencies are like possibly even more complicated. But self-insured private employers, some of them are under what is called a grandfathered plan, and essentially there's certain things they may not have to cover because they are not required to be ACA compliant in quite the same way. Okay, so things to look for in the plan documents. Plan documents are long, they're ugly, but they contain a lot of information for you. So the plan documents will tell you things like virtual visits, how much you pay for them. So this is a great example. This is from like a plan document for a healthcare plan that I've previously had. Virtual visits are covered in full. Now, this is an extremely important check mark right here. It might be a check mark, it might be a star in your plan. What it is deductible does not apply. So, deductible is not apply is extremely important. If you are getting a high deductible plan, you need to know what you can pay that copay for without having to hit that high deductible. So my deductible is $8,250 a year. But my, if I go to a virtual visit, it is free to me, even if I have not hit that deductible yet. So these little check marks make a huge deal. So all of these check marks here, they're trying to make it look like they're extremely generous, but all of this preventative care is mandated under the ACA to be covered. So all of these things have to be covered in full for you if you are on an ACA compliant plan. Periodic health cares and well baby care, routine immunizations and shots, colonoscopy, preventative for people that are age 50 plus or people that are at high risk that need colonoscopies even if they're not over 50 plus, Gynecological exams, breast exams, and pap smears are covered. Mammograms, nutrition counseling, tobacco cessation programs, substance abuse counseling and classes, HIV and PrEP medication are fully covered. All of those things are entirely covered, and they have to be covered under ACA plans. So this is also a really important thing. I think a lot of people, if they have high deductible plans, might put off going to their primary care doctor. They might have the sniffles or something, and they're like, I don't want to go pay whatever it's going to be to go visit my doctor. However, this amount here is your copay, and because that check mark is right there, it would cost you just $50 as opposed to costing you hundreds of dollars as it might to go see your primary care provider if you had a problem. So a great example for me is that I live in a state where I can't go get Sudafed over the counter. I can get like fake Sudafed that doesn't actually work. For our one UK person that is up too late, Sudafed is kind of the equivalent of day nurse in the UK. That is not available over the counter in my state, and you have to get a doctor to write a prescription for you. That being said, I was unwilling to go get a doctor's visit when I have the sniffles, but I did really want some Sudafed because I still needed to get some work done from home and wanted some sort of cold medication to fix it. And I was able to do a fully covered virtual visit to just be like, hello, I have the sniffles. No, I am not making methamphetamines in my bathtub. Can you write me a prescription for Sudafed? And I was able to get that Sudafed sent to the pharmacy that is a block from my house and fill that. I could have also biked to a different state, but I didn't feel like that was going to make me recover from my cold faster. So the other thing you need to look for is if you have one of those online formularies where you're able to just like look for the drug, then you can search for your drug name. It is important to search for your drug when you are looking for an insurance plan, because all of the copays and deductibles don't matter in the world if you just have to pay out of pocket for your drug, and your health insurance plan will never cover it. So there are different kinds of plans. For your different kinds of plans, essentially towards your overall drug costs, and each kind of drug might be on a different tier. So as you can see, there are 2 tiers here that are considered to be deductible does not apply. And one of the huge advantages of deductible is not applied drugs is it means you can fulfill your drug cost for $32 rather than the possibly hundreds or thousands of dollars that prescription might cost you if you haven't hit your deductible yet. So essentially what I'm saying is if you're on a common generic drug, do not freak out too much if you are getting on a high deductible plan, because it might just be that you're paying $32 a month for your 30-day supply. Does this make some sense? So what are all these tiers? Well, essentially, these higher tiers, you're going to be paying for a higher percentage of the drug cost. The tiers will vary from plan to plan, so this isn't like a universal thing nor a universal cost. This is something you're going to need to find in the formulary document. The tiers might be called different things. They might be called generic versus preferred generic, or they might be called tier 1, tier 2, tier 4, tier 5, tier 6. So a great example is my drug is a tier 6 drug. It is called a specialty drug. That means that I have to pay 80% of the cost. And deductible does apply to it. And my drug is $7,800 a month, going up to $10,000 next year. Let's use $10,000 because it's a round number. That means I have to pay $8,000 out of my own pocket before my insurance will cover that last $2,000 of it. But there are other important parts of a formulary here. The other important parts of the formulary here are the coverage note abbreviations. These abbreviations are different on all different formularies, but they are so important. If you have a hard to cover drug, a hard to cover drug would be something like a specialty drug. So if you get infusions, chemotherapy, if you are on a specialty drug like a biological that is refrigerated, requires handling from a special pharmacy, then it may have any of these notes next to it. One is PA, prior authorization. That means that your doctor is going to have to send a stack of paper to a medical review board, and that medical review board is going to have to determine if that drug is covered for your condition. So this can be extremely important because if you are getting a drug that it has what is called an off-label use, so let's say that you are getting treated with a rheumatoid arthritis drug for psoriatic arthritis, and it's not yet approved for psoriatic arthritis, but your diagnosis is psoriatic arthritis, and it is proving to be effective for you. However, the medical review board may say, you don't have the right diagnosis for us to approve this. And then your physician's going to have to send a back and forth with it. So this is important to know if there is a PA next to your drug. Quantity limit. Quite often, a quantity limit just says that you can only get a 30-day supply at once. It could either be because it is a controlled substance, or it could be because it's really expensive. Usually those are the two things. Sometimes it can be because it has like special handling properties and they are worried you could accidentally poison yourself by having too much of it around. It could be any of those things. Okay, step therapy. This is incredibly important. So step therapy is a thing. It's legal in almost every state. There's a couple states where it's banned. But step therapy means that that drug, you have to try all of these other drugs that are cheaper and you have to fail on them before you can get approved for the other drug. So a great example is my drug has what's called step therapy restrictions on almost every plan I've been on. And I have to submit the documentation to show that I have failed at all of the other cheaper drugs. So I have to actually prove, my doctor does, through medical documentation, that I've already tried methotrexate, sulfasalazine, essentially the cheaper drugs for my condition before, and I had not had a therapeutic benefit from them in order to get approved. Step therapy is really important because if you change plans and there's a step therapy restriction in place, you may be forced to go off of a drug that's already working for you and get on a drug that fails. So you need to have a good provider to advocate for you. It's usually actually the admins that actually know a lot more about this. And then the actual doctors themselves, or you need to have a lot of tenacity on a personal level or like an advocate in your life. And limited access drug, it's rare, but it's usually limited access or something like it's a specialty drug. It only comes through specialty medications, or there can be an even more complicated thing that you don't really need to know about it, but essentially it's like a subsidized drug. So it has to go through certain kinds of 403B pharmacies. We don't need to get too deep into that, but things to see is there might be lots of things that are listed as being zeros. That means they are considered ACA preventative. If they are on the formula 0, that means that they cost nothing to you. All right. Anybody have any questions about formularies? Rural says, my new drug is 98 cents for 30-day supply, HDHP, so we pay full cost until we hit the deductible. That's amazing. That sounds fabulous, and I'm really happy for you. Yeah, anybody else have any other kinds of questions? That's amazing. Should we take a donut break before we dive into the type of plans and how to figure out if you want an HDHP or a low deductible plan? This is a lot. I know it's a lot. We're already almost an hour into the live stream, so we're going to eat a donut. Should I eat the fluffernutter first. Look at this. Look at this thing. Woot. Dean says, I'm just so sorry, y'all. This is hella complex. Correct. Correct. It is hella complex. Crystals, guys, as I'm actually applying again, I applied when I got off my parents' plan, and last time they told me I wasn't covered under anything other than private companies. Meaning like a private health insurance plan, or I'm kind of curious. I don't really understand what you mean by weren't covered under anything other than private companies. But you can apply again if you are doing a healthcare.gov. Open enrollment is right now, which means you don't have to have a change of life status or anything. All right. Fluffernutter this is so intense. Okay, that bite just tasted like donut. I'm trying to go for like a bite with all of the flavors in it. Oh, man. Okay, I just got a bite of this and it tasted exactly like a fluffernutter sandwich. Like, it has these little peanut butter balls are amazing. Is that just fluff on the top? I guess it's cream. It goes all the way through the middle, though. I don't think it has a particular flavor, though. Yeah, I think it's just fluff. Oh, Christina has a good question. I'm going to dive back into. Dean says, you know what I would do? I would smush the two donuts together and just inhale both. I don't think they would taste good together. Okay, the cream is like heavenly. Okay. Should I just finish the whole thing? Oh my God. This is so much. All right. I love the peanut butter, but I don't really. I guess it's supposed to be equal like the marshmallow fluff on the top. I don't really know what the. Okay, we're going to look up what the top coating was because I'm not entirely sure. They really do believe in performative donuts at your local store, don't they? They do. They believe in lots and lots of things. All right, sorry. This is very boring. I'm trying to figure out what the heck the thing it is. Okay. So, we had a very good question that is almost off the screen now, but it was Christina Tran asking, can you still choose to pay for a subsidized plan even if you qualify for the state's Medicaid program? My income keeps fluctuating and I'm tired of switching back and forth. This is an incredibly commonly annoying problem for a lot of people, because essentially the way that income works for these health insurance plans is different depending on whether or not you qualify for Medicaid, which for most states now have, the vast majority of US states now have Medicaid expansion, which means you qualify for it if you're below poverty level. But how you estimate your income with regards to subsidies on the health insurance exchange is like super annoying and hard. And I actually got an extra $2,300 back this year because I was getting too much premium tax credit last year, saved up knowing I would have to repay it at tax time. But then there was a special only this year refund where you did not have to pay back your overpayment of your premium subsidy. So with Medicaid, the your income is based on your monthly income, but with all the other subsidies, it's based on your annual income. And so it puts a lot of people in a super challenging position. As Rural said, you can't get a subsidy if they think you should qualify for Medicaid, even if your state hasn't expanded so you don't actually qualify for Medicaid, which there's only a few states that are still in that camp, although there are like, I think now 6 holdout states that like no amount of carrots from the government can make them want to get poor people health insurance, which is very frustrating. But so it is super annoying to switch back and forth. One thing that you can do is you can kind of, if you make the income estimate, if your income keeps fluctuating back and forth, and you can make your income estimate go for the annual amount on healthcare.gov or whatever your exchange is, go slightly above whatever the healthcare premium subsidy amount is, then the amount to qualify for Medicaid, so that you, for the entire annual year, then you could just stay on one of the subsidized plans with the cost sharing subsidies, which is a good option. One downside, though, is if you're getting a really large premium subsidy, which you would be if you're right on the edge. So let's say that you are getting $300 of premium subsidy and you actually had a low enough income you would have qualified for Medicaid, then you would end up in the camp of the at tax time next year, they could claw back some of the subsidies that they gave you on a monthly basis in your taxes. The good news is there's a limit to how much they can claw back. So As I said, there was like a special exception last year for how much they could claw back. But now it's based on poverty level. So now the maximum amount of clawback that they can have is $325. So you have to decide if the annoyance of switching back and forth is worth possibly having to pay $325 to you at tax time, if that makes sense. Rural says 12 states have not expanded Medicaid. I thought it had dropped recently, but I might be wrong. I thought it had dropped because of the carrots in the ACA. I think there's a couple other states that it's not currently implemented yet, but I thought that there were between 4 and 6 states that decided to take the expanded Medicaid, but I don't think they can put any more carrots in. So, I don't know if I'm misremembering that. Yeah, it's really frustrating. Oh, I love that my iPad just keeps like going to sleep and then it decides. Oh, right. Okay. This is my numbers getting confused in my head. It was 16 and it did drop to 12 states now. It's too many. It's too many. I don't know what we have to do to tell people that they should make it so low-income people can get access to health insurance. Very frustrating. Crystal Sky says, I know I am frustrated at least, lol. I know. It's very frustrating. Okay, so the very basics of the types of plans out there. The thing I want to emphasize is that a plan can be high or low deductible and still be any of these types of plans. So the type of provider organization that you have, like if it is a PPO, an EPO, does not necessarily mean that it wouldn't be a high deductible plan or not. So types of plans: exclusive provider organization, a managed care plan where services are covered only if you use doctors, specialists, or hospitals in the plan's network, except in emergency. All of these have to cover you as though it is in-network if it is an emergency, if they are ACA plans. A health management organization, a type of health insurance plan that usually limits coverage to care from doctors who work for or contract with HMO. No out-of-network except in an emergency. They often have more wraparound services, so they're called health management organization. A health management organization is like, they'll often have like everything in one building. Like here, the common one is Kaiser, who is actually the people that started HMOs. And what I did like about it is it was very nice because all of my providers were in the same building and they were all like networked on the same computers. So essentially I'd just be sent around the building and I could do all my stuff in one thing. The downside of it is that like if you are really attached to a provider and they're not part of the HMO, you just won't be able to go. I've had a lot of friends who've had HMO, the HMO Kaiser, and a lot of people have expressed that they do like it if they're going through something very normal. So something very normal might be like breast cancer is a thing where the treatment protocol is pretty step-by-step. It's like they kind of have a certain way that they make a lot of different course of treatment plans. And because of that, the health management organization was really nice because everything kind of wraps around. You have a provider care team that all talks to each other. A lot of the services are in the same building. And it's very predictable to know what's next. So it required like a little less work. I also recommend HMOs to people that like don't really do a lot, that just kind of want to know that everything is like handled by one organization. Quite often HMOs will require you to like live in a certain city or something like that. They can suck if you're on an HMO and you don't live anywhere near where all the HMO doctors are. So a point of service which is conveniently called a POS, which I love, is a type of plan where you pay less if you use doctors, hospitals, or healthcare providers. An important thing about a POS is that everything comes through a referral from your primary care doctor to see a specialist. So you may have to get referrals on an EPO or a PPO, but you're always going to get them for a POS. And preferred provider organization, it's pretty much the same as an EPO, except that it can be a little bit more broad. So EPO's exclusive. So EPOs are like a more narrow network, and PPOs essentially, there might be a lot of providers that are on them. So copay versus coinsurance, it's not that complicated, but it just seems confusing. They're essentially synonyms, but a copay is usually a flat amount versus coinsurance would be a percentage. So if your coinsurance amount is 40%, that means you have to know how much the thing is going to cost you. And that can be one of the really frustrating things because it can be really hard to figure out how much things are going to cost in the US. As you heard, I keep saying my drug is $7,800 a month, but I actually looked it up recently and now it is $10,000. And that's the kind of thing where I'm not in a lot of control, and technically I pay a percentage coinsurance on that. A flat amount would be something like $10 or $50. Okay, so Iris Bear asked a question that I feel like is exactly what we are leading up to here, which is, do you think that a high deductible plan is still a good idea if you rarely hit the deductible? Almost always, it is going to depend on what you need, but I'm going to walk you through how to do the math. But I do want to mention the things that you get for $0 if you are on an ACA approved plan, regardless of whether or not it is a high deductible plan, low deductible, and the deductible does not apply. Most preventative vaccines, certain drugs, fluoride for kids, folic acid for people that are either going through chemo or people that are expectant mothers, smoking cessation programs, statins, PrEP for people that are trying to avoid HIV, that are at risk, aspirin for certain people, bowel prep for colonoscopies, and breast cancer prevention drugs for people that qualify. Your annual exam, so if you get a routine annual exam, that is $0 copay despite deductible. Make sure it is coded properly. Contraceptives, reproductive health exams, screenings, including for STIs, a ton of different ones. That the preventative vaccines includes the HPV vaccine as well. HIV screening and counseling is free. Certain pregnancy screenings, if you are pregnant, for making sure that your pregnancy is healthy. Certain things like that are covered without deductible, and breastfeeding support and counseling. But this might be one of those things where the breastfeeding support and counseling you're getting through your PPO, your HMO, isn't really working for you, and you may have to go outside of there. So, these are the things that have to be part of what the plans cover. That does not mean that the plan covers it for no deductible or anything like these do. This just means that if it is an ACA plan, it has to cover these things. Outpatient care that you can get without being admitted to a hospital, any emergency services, hospitalization like surgery and overnight stays, pregnancy, maternity, and newborn care, mental health and substance addiction counseling and disorder services, including inpatient behavioral health treatment. Prescription drugs have to be covered. Rehabilitative and habilitative devices, laboratory services, preventative and wellness services, and chronic disease management, pediatric services, including oral and vision care. Adult dental and vision coverage is not considered an essential health benefit. So if you are planning on having a kid, this is one of the really big decisions that you have to make during open enrollment. If you are currently expecting or you hope to be expecting during the next plan year, you need to look out for a couple things. One, when does your deductible year reset? For most plans, your year for your out-of-pocket maximum and your deductible will run from January 1 till December 31st, but that is not universal, especially if you are on an employer plan. So you want to look out for that, because if you get pregnant and you have a kid in March, you will have gotten all of the money that you had spent on anything for the beginning of your pregnancy it would have been in the previous plan year, and you will have to hit a new deductible and out-of-pocket maximum for the actual birth. So that can be really frustrating. I also would recommend looking out for the birthday rule. Essentially, if you have two parents who both have employer coverage, a lot of insurance companies will require the kid to be on the parents whose birthday comes earliest in the year's employer plan, which can really suck if one of the parents has very good insurance and the other does not have very good insurance. So remember that when you're looking out, and then remember that your kid is a change of life status when you have them. This is also true if you are not the birth parent. If you are doing same-sex second parent adoption, then that would count as adopting a child, and that is still a change of life status for you. So just a thing to be aware of. Anybody have any questions about pregnancy and stuff like that? Very few plans do cover IVF, but there are ways to look for fertility planning that's way beyond the scope of this podcast. But okay, we did talk a little bit about estimating your income, but I really want you to know that for 2022, there is if you qualify for a marketplace plan, a healthcare.gov plan, or an exchange plan, they have expanded it so that everyone gets subsidies. So it used to be that you fell off this cliff, but just for 2021 and 2022, it does not matter how much you make. Even if you are above the maximum income, then you qualify for subsidies, and you will not have to pay more than 8.3 of your household income on your healthcare premium, which is a huge, huge deal. So if you are trying to estimate your income for healthcare.gov, the thing to know is to know that one, there is a maximum amount that they can claw back from if you essentially overestimate your premium. So for me, my income is really variable. If you choose to kind of put your income at the low end of the estimate, you might get more premium subsidy. So you pay less per month, but you may, if you make more than that, you may have to pay it back at tax time. But there is a maximum amount that they can claw back of that premium subsidy for this year alone. If you have the money and the cash flow month to month, and you want to max out, like essentially you want to not take any subsidy month to month, but your income actually turned out to be lower, then you can get that money back on your taxes. So whatever you would have been owed. Essentially, this is all shored up in taxes. There are a couple good places to go. I really recommend the IRS has a very special tool for estimating it. I'll try to link in the description below. But the IRS has an estimator, and there's also an estimator on healthcare.gov of how much subsidies you will get. But what you really need to do is put your income in, or your guess of your income in, and then look at the plans available to you. So 2022 is super special. No one at any income level has to pay more than 8.5% of their household income for a benchmark plan. Everyone can get subsidies. It used to be that if you made more than 400% of federal poverty level, which for a single person, I believe was like around 51,000 in my state. If you made more than 51,000 a year, you just fell off. So you would get all sorts of things. If you qualify for an ACA plan, you most likely are going to get the best deal for this compared to any other kind of plan that you're going to get. So let's get to the deductible calculations. Oh, the most important part of this, but yet it's taken us almost an hour and a half to get here because American health insurance is so complicated. So there's essentially two reasons to get an HDHP. If you have low health insurance coverage or very high health insurance coverage. If you're getting most of your drugs covered by something like copay assistance. So HDHP, or a high deductible health plan, means that you qualify for a thing Rural asks, if you don't make enough money, you still can't get a subsidy, can you? You can if you make above 100% of the federal poverty level. And if you are received unemployment at any point this year, then you get a $0 premium for the plans on the healthcare exchange. But no, there is still the Medicaid hole. So the way that an HDHP is set up is essentially there are like actual requirements for what counts as a high deductible health plan. These are not necessarily catastrophic plans. They'll just have a much higher plan than maybe you're used to. So the HDHPs will also not cover anything except whatever those required free services are, like the required, essential benefits that they have. They won't cover any of those. If they have like a lower prescription amount before you hit deductible, then they would not count as an HDHP. So there's very specific rules for them. So the way that HDHP works is that they cannot have a out-of-pocket maximum greater than $7,050, and they have to have a minimum deductible of $1,400. So the big thing to know is that at the very minimum, your deductible is going to be $1,400. If you are on a lower deductible plan, your deductible might be $200. It might be $500. High deductible plans can go as high as a $7,000 deductible. I'm on an HDHP right now through my employer, and my HDHP my out-of-pocket maximum is $8,025, and my deductible, I believe, was $7,000. But why would you want an HDHP? Well, they cost less money per month. So either your employer or you might be interested in them. Employers really have been trying to push a lot of people towards choosing high deductible plans. And one of the sweet, sweet benefits of a high deductible plan is that you are qualified to use this thing called an HSA. So an HSA, or a health savings account, not to be confused with the similarly named FSA, but it is not the same. That is a flexible spending account. Ironically, the flexible spending accounts actually are less flexible than the HSAs. So, when we talk about saving money for retirement, I usually talk about there's two buckets. There is buckets where there no taxes now, but then you'll pay taxes at retirement. And there is a bucket where you will pay taxes on it now, but then there's no taxes when you pull it out. There is one special category of account that is tax-free both sides. It is the only one in the United States, and it is called a health savings account. So a health savings account is quite simply, if you have an HDHP, it is a special savings account that you can put pre-tax money into, and you can use it for medical expenses. You can just keep saving in there for the big one. Or at the time that you turn to retirement age, you can actually just pull money out. What's also cool about it is once you hit a certain threshold, I believe it's $2,000, you can actually invest the money in the market in your health savings account. So it is literally just a savings account for health problems. And it can also serve as a lovely rainy day fund, because if you have medical expenses that you're paying for out of pocket, like prescription drugs where the deductible doesn't count, or, things like condoms, which are technically covered under ACA plans, but condoms, or certain kinds of, over-the-counter drugs, or various things that you might get from a pharmacy, or really expensive things. If you keep the receipts from that, you can get money out of your HSA years down the road. So you could hang on to those receipts if you wanted and use it as a backup emergency fund. What is great about HSAs is that they carry over year to year. There's no use it or lose it provision that you might be used to with something called an FSA. They are an excellent long-term savings approach. Like, they are very cool, and there is no vesting. So the last super cool part about it is, because your employer desperately wants you to have a high deductible plan because it costs them less money in premiums, they might very well give you money for your HSA. Some employers will give you $600, some will give you $1,000. There is a limit on how much they can put in it, but they're putting that money in you, and you get to take that account with you when you leave your employer. It is not tied to your employer, it is tied to you. Craig says, what are your thoughts on using HSA as purely a long-term savings approach and paying for medical charges out of pocket through the year? I think it is a great strategy. I think as long as you're able to cash flow for it, the HSA is great to use as a long-term savings approach because, one, it converts to a regular account, not just for medical expenses at retirement age. Two, you can invest it, and it's tax-free. Obviously, $3,650 is not all of the money that you're ever going to spend on medical expenses in the United States because we're very broken. But I think it is a very, very good tax strategy for people because the money that you save in the HSA, you can save it each month out of your paycheck and you could not even feel it. And you don't have to pay FICA taxes on it. It is tax-free. So Iris Bear, is a high deductible plan still a good idea for you if you rarely hit the deductible? So the things you need to calculate if deciding if an HDHP does make the most sense for you is, one, look up how much you are going to have to pay for your drugs. So if you do get regular prescriptions, or you have regular visits to a mental health provider, a specialist doctor, any of those things, I want you to look up how much those are going to cost you until the deductible. So you have to have kind of a rough estimate of what your usual and regular expenses are. Decide if you're able to cash flow them. Then I want you to figure out what the difference is in premium cost. So if you have an employer plan and your options are a high deductible plan that would cost you $0 per month out of your paycheck, but it would cost you $200 per month to be on the lower deductible plan, that is $2,400 a year that you are saving. Okay, now the question is, can you cover $2,400 a year? And of those, can you use that money either by saving it in the HSA and keeping that savings account? Because the thing about paying for a lower deductible plan, if you don't have regular expenses or you won't hit the deductible, especially if you don't hit the deductible on a lower plan, is every month the money you send out in premiums, you never see that money back, right? So that $200 a month that you're paying out or whatever that you are paying, you never see that money back. But if you are on a high deductible plan, you have access to a health savings account. You can set one up on your own. If your employer doesn't have one, you can just go set one up. And then you can save that money that you've saved in a savings account and you get to keep that savings account. And the impact on your taxes is the same either way, versus the premium. And then the other thing is if your employer gives you money on top of that, then you've got a really great argument, right, from that there. Another reason to have a high deductible plan. So for me, I have a high deductible plan, even though I have very high healthcare expenses. And that is because I know I'm going to hit my deductible either way. And most of my deductible gets paid for through copay assistance. So if you are on a really medically expensive drug, I have a friend who was recently diagnosed with MS and they sent me all the things because they're trying to figure out which insurance plan they should get and how much the drug is going to cost them. And I ended up being able to look through and go, oh, you definitely want to get this plan because this drug is on it and you have copay assistance. So as soon as you hit that out-of-pocket maximum on your plan, even though it's getting paid for by copay assistance, which is essentially coupon medications, everything you get for the rest of the year is totally free. So for me, I'm on a high deductible plan, but I hit my deductible in February each year, and then all of my medical costs are free for the rest of the year. And if they are an ACA plan, you still have that stop loss of an out-of-pocket maximum. Of course, obviously, there's always frustrating things with your health insurance plans of trying to figure out if arguing with them about whether or not a provider is in or out of network for certain kinds of care. And that is one of the really frustrating things. But you can watch any of my other live streams to hear me kind of argue about that. So this is the IRS website that I recommended if you're trying to figure out what those premium differences are going to be. We talked about what's very frustrating about Medicaid is it is based on monthly income versus healthcare.gov is based in annual, and you might end up switching on and off of Medicaid and healthcare.gov. Medicaid is great when you're on it because it's totally free, but it can be super frustrating to have to keep switching between plans. And there's certain things you might not qualify for if you are getting government paid for insurance like Medicaid. So for example, I can't get copay assistance on Medicaid. And that's because Medicaid will pay the full amount of my medication. So why would my pharmaceutical company subsidize it double? So this website, which doesn't look like an IRS website, but totally is called the Premium Tax Credit Chart Change Estimator. And it looks really boring, but what it will help you do is try to figure out how much that annual premium tax credit is based on changes in your income. So this is like, you can easily do it for just yourself if you are like a single person or a couple, but once you have kids and you need to figure out like the back and forth of like, what if I have a kid in June and then my income goes down for this number of months? Then you're going to be able to do all sorts of calculations about what the exact amount is, and you don't have to do the work if you use this website. I actually do really recommend it. So that is the basics of the HDHP. Does anybody have an individual scenario they want to go through? Because I'm happy to walk through like a specific, this is how much the premium is going to cost. Should I get an HDHP? Wait, how do I figure this out? Like, throw them at me. Throw your questions at me because there is obviously a ton of questions to ask about this. It's very hard and frustrating. So Iris Bear said, I didn't think of calculating the full cost out. Yeah, I think the big thing that you need to understand when you're deciding on the HDHP is how much you can handle the shock of whatever that out-of-pocket maximum is or that full amount of that deductible. So if you're saving $2,400 a year in premiums and you're putting that into a health savings account, if your high deductible is $2,000, then you come out just the same because you've got that, you've got that $2,400 in a savings account. So you're actually coming out ahead. But the downside of that would be if being on a high deductible plan means that it has a higher out-of-pocket maximum for you, and your out-of-pocket maximum is $7,000, and you're like, there's no way I could come up with $7,000. Then you may want to go for a plan that might cost you a little bit per month, but will give you greater peace of mind in an emergency situation or a high-cost situation. Iris Bear says, my drugs are cheap generics and my kids' drugs are very expensive unless I use good RX pricing. Well, the good RX pricing is like, it's fine to use the good RX pricing for the kids. Also, you may or may not be able to do, yeah, it's kind of frustrating. So, I'm trying to figure out, like, there's some things for kids under 18 that that are more covered. And then additionally, some kids can be covered under the children's health insurance plan, even if you don't actually have a low income, but it really depends on the situation. But CHIP fills the gap for a lot of parents with kids, especially if they have kids on expensive specialty drugs. Crystal Sky says, why on earth is my monthly so expensive? Erg, my brain hurts. I'm sorry. Okay, so how much is your monthly premium? Or are you talking about your monthly drugs? Because, because my monthly drugs are out of control. Also, I've been just making up random costs. So I do want to kind of do it back and forth. But if you should qualify for a healthcare.gov subsidy and you, but you're on the low income edge, where you might qualify for Medicaid, you should have a low monthly premium because you should be getting extensive subsidies. So it's important to make sure to check healthcare.gov website and put in your income at whatever that high amount is that's above whatever that is. My monthly premium, I finished the application process and it's over $300 a month, but it doesn't cover anything. Is that the only option available to you? So, because you should have more than just one option available to you on your exchange. You should have quite a few of them. 300 is super frustrating, especially if you were previously qualifying for Medicaid. You should be getting more of a subsidy. Is it possible that the $300 a month is the premium subsidy? Not to say you're reading it wrong, but it's a very confusing website. I think I'm happy to reveal. Let me see if I can pull this up and it's not super revealing, because I'm happy to walk through the healthcare.gov website settings if I can and show you. Oh my gosh, we have to do floof of the week. Oh, we have another donut too. We have so much stuff going on, y'all. Are you willing to share what your income is? But it won't. You're going to get different options depending on your state. But if you're willing to share what your annual income estimate is, I can try it as an estimate on my own healthcare.gov and share it. Because it's worth looking through what they are. I'm going to select my state. I think I can do all of this. Crystal Sky says, I'm a college student. All of my income is from federal grants. So here's the thing. If all of your income is from certain federal grants, depending on which line on the tax code they are, then you should not, it actually doesn't count as the right kind of taxable income that you have. So if all of your income is coming from federal grants, you really should have more options than a $300 a month premium. Okay, so I'm going to walk through here. Also, if you're a college student and you're younger, then your premiums will be lower. Okay, I'm going through the application and I think we can do this. I'm gonna share this. Hopefully I don't reveal anything terribly. I'm gonna do kind of a fake application for me. Okay, so my income is $54,000 or less. I'm looking for Oregon. You're 28, so you've been off your parents' plan for 2 years. That's good. You're young. So, because one of the things is if you are, your premiums do go up quite a lot as you're older. So, as you get up and up, it gets there. But so some federal grant income can't be counted towards subsidies, which means that your income would be lower. But also, if you're a college student, they will have a catastrophic non-ACA compliant plan on your campus. Usually it's usually not a great plan, but that is an option at almost all universities and community colleges. Let's check for all savings options. Is everybody able to see this? Okay, we are looking. We are going to do, we'll just do 87. That is not my current address, so it's fine. You can't dox me. Sure, let's say that's my address. It's a very old address. All right. And why is it taking so long? You are definitely not the only one that is confused. Okay, so one thing that you might be doing is if you are looking here, if you said skip these steps and you said see full price plans, you're going to see them without the subsidies. So you do have to make sure, because like if you're seeing this for full price plans and they don't have information here about showing you how much you're saving up in the corner, because they should say like the amount of the premium and then how much you're getting in a subsidy, because you would qualify for a subsidy. So the only situation that you may run into is if you are considered a tax dependent on someone else's taxes, then you don't qualify for the subsidy. So that could be the problem that you're running into. So like if you are in the situation where you are considered a tax dependent for someone else, and then you can't technically be your own household, and then you wouldn't qualify for the subsidy, which is a really super crappy place to be, in which case you would want your parents to apply to get a healthcare.gov plan for you, and get a subsidy based on their household income amount, because you cannot qualify on their plan. It's like a frustrating one here. So if you like, it is super confusing. So Crystal Sky, you are 100% in the category of like everybody. There's no one for which this is not confusing. And I have passed an actual exam on how to understand this stuff, like a licensing exam. My parents haven't claimed me for 2 years. The monthly premium is the monthly cost. Yes, but if you're seeing this, the monthly premium is the monthly cost, and as long as your parents can do it, as long as your parents aren't claiming you on the taxes, you do qualify for a subsidy. Parents can do that after the age restriction, but it's more complicated than that. But they can't do it through their employer usually. Some employers will cover you longer. The thing is if you're looking at this and it doesn't have like a little green thing saying how much you save on it, then here, I will go off so that I can make sure anything that is like specific to me is off the screen really quick, but I'll show you what it looks like if you have savings up on healthcare.gov. Okay, so you do have to make sure that, okay, you know, none of these. Okay, so what was your estimated income? I will put 19,000 as my estimated income because I know that's over. Okay, so here is exactly, like, this is the thing I'm worried you have. So if you put your income in as like 19,000, you're going to see this, and it might look like a premium, but this is how much you are going to get towards the savings. So if you do the view plans, you should be seeing an estimated premium that shows you how much the plan was and then how much your premium is. So this was estimating my annual income at $19,000, which, I was like saying, oh, okay, that's like a slightly over Medicaid amount. And these are the different options that I have. Usually, so these are all high deductible plans here. And so that means that they're going to have really outrageous deductibles. Notice that your premium, the amount that you can save, is actually greater than the amount of the plan. And because of that, you're usually better off getting what is called a silver plan if you do have a high premium amount, not a bronze plan. So see silver plans. So the advantage of the silver plan, so this was me estimating my income at $19,000. And the $19,000 here is means that I get a $346 tax credit, and my estimated monthly premium for this plan is that. But look at how low my deductible is that. So Crystal Sky, I think you may have been looking up your premium amounts without putting your income in. So it's possible that you put in your income without, or you put in your monthly income because you're used to that for Medicaid instead of your annual income. On healthcare.gov, you want to put in your annual income, because if you only put in your monthly income for your annual income, it would say, oh, your income is too low. You don't qualify for subsidies because America's terrible. Does that make some sense? So you should be able to see on the, oops. Okay. Oh, I hit fade out music. Hopefully music doesn't start. You should be able to see this like tax credit thing. And what you want to do, as long as your income is quite low, you want to aim for those silver level plans because they're going to have these lower deductibles and out-of-pocket maximums on that. What website is this? This is healthcare.gov. This is the marketplace exchange for anybody that is considering getting a plan and qualifies for a marketplace plan. So your state exchange might look a little different, but if you go on to healthcare.gov, it'll tell you if you have a special state exchange. Craig F says, what would you happen if you included a spouse, partner, and kids in your scenario? Would price be about 2.5 x time? Well, your premium would probably not be 2.5 times because one, the big thing is that your household income, the more people you include and the household income is, if the household income stays the same, like for example, you're a single earner family, the more people that you support on it, the more you will, the more subsidy you're going to get, right? The Journaling Broom says, oh, okay, I just wasn't sure we could view plans without submitting an application first. So you can go to preview 2020 plans. They go to preview 2022 plans and prices. And you can essentially put them here. You can essentially do an estimate on your savings and stuff like that. What I will also say about health and dental plans, adult health and dental is usually pretty crap, because it's not regulated by the ACA in the same way. So usually it's not worth it, but for some people, it could be worth it, but often they will not pay more than like $1,000 a year, and you're paying like $30 a month for them, and you could just get a cleaning for about the same amount of money, and like some cavities filled for cash rate, but it kind of depends. Christina Tran says, any advice on verifying self-employment income, when they ask about uploading docs to verify? Okay, here's the thing. I've always just had like a little table that I did that was like, here's my estimated profit and loss. And I just like put a PDF and uploaded it. I have never had anybody like come back to me and be like, your docs were incorrect. So I think don't stress about it too much is sort of my argument. It's actually the same thing about like with taxes, where as a self-employed person, you're like, wait, I just tell you how much I made and you trust it. So yeah, my recommendation is kind of just do your best. If you are someone who mostly freelances and you do get a lot of 1099s, then you can upload some 1099s. If you've been self-employed for a while and therefore you have last year's tax return, they'll totally accept the first page of your tax return as sort of like a guess and an estimate. But yeah. Crystal Sky says, now I do not know how to go back and change it. Why is this website laid out so badly? Agreed. It's better than it was, but it's better than Oregon's was. Ours was so bad it never launched, and we had to revert. We spent tons of money on it, and then we had to revert to using healthcare.gov because we're ridiculous. Okay, so when you go in to healthcare.gov, I believe that you can go and log in to change, renew plans, and I'm trying to, not now. Okay. You can go to my applications and coverage, and then you can change whatever your applications are. So like you can actually click into them and change your things there. It would be your plan profile there. No, wait, it would be eligibility and appeals. So you can go change your applications in there. Not that I'm like love being tech support for this website, but you aren't going to hear back from them. So I would rather that we just stumble our way through it together and try to figure out what's happening with it together. It can be so frustrating. Craig, did you want to actually puzzle out what the estimate would be for, because if we do keep it for $19,000 and then we add a spouse and a partner in there, then you would qualify for Medicaid because that's below the family poverty line for a household of 3. But if we just want to look at what kind of it would look like to kind of do some guesses, to do some previews, we totally can. So if that's useful to anybody, I don't know if we want to or not. Okay, so you can actually preview plans and prices before you actually fill in this like dumb application and everything. So if you go from the quick tips on the front page, so if you go to the get tips, and then you go to 5 preview available plans, we can do an estimate. So we'll just do, we'll do a Multnomah County zip code. That's not my zip code, so don't try to dox me. And we can just do an estimate. We could just do an estimate for, me and other people. Okay, we'll do 3 people. Am I married? So this is what is important here, because remember how I said that if your partner has access to employer plans that can cover you and your dependents, then you can't qualify for a subsidy. There is a special rule for victims of domestic abuse or spousal abandonment. So essentially, if you are considered spousally abandoned, meaning you're like maintaining separate residences, or you can't get a hold of your spouse, or you are a victim of domestic abuse, then you are able to get a subsidy. It is important to know. Okay, so we'll say, yes, you are married. Will you claim a dependent on your tax return? We'll say 1. And we will say one person is 30, female. Any of these that apply to you. Legal parent or guardian. None of the other ones. Continue. Spouse is age 31. They're also female. And they are the legal parent or guardian under 19. You have to have documentation for that. Spousal abuse, abandonment. You do have to have documentation, but they are pretty generous for it. They are pretty generous about it. Okay, let's say you have an 8-year-old dependent, and we'll say they're female and they are not eligible for any of these things, and they are 8, and I hope they're not a tobacco user. Okay. And we will say the household income is $49,000. So, they are trying to say that your dependent has a low enough income level that they might be covered by children's health insurance plan. So this would be the premium tax credit that you get for 2 people. So this would be based on you and your spouse. And we're going to go look at what the silver plans would be because, oh my God, this website. Okay. The silver plan. So this was how much it would be, but this would only cover the 2 adults. This has the 611 healthcare premium. And this is only covering 2 adults because the kid is eligible based on the family income for a children's health insurance program, if that makes sense. Crystal Sky says, I changed it and it's still giving me the same thing. Maybe I just don't qualify for anything. Do I really need healthcare? Can we just do this for you? Can we do the fake estimate for you and your zip code? Because I just want to see if it's like you have a caching problem on your computer. I want to believe you have better options, Crystal Sky. And then we can have this creme brulee donut and look at more cats because this has been very hard. If you want to do that, we can try it out for you. We can try out the preview for you because I want to solve this problem for you. Do you really need healthcare? I want you to have health insurance because I didn't have access to it for most of my early 20s. So, yeah. This is the donut we're going to try after we check out Crystal Sky's thing. This is the creme brulee donut. And like, yeah, it's really hard to like capture it, but it's got like a pear situation. Let's get Crystal Sky's stuff here. We're not going to reveal any privileged information here. Also, we don't know your real name. So, okay, 33904. And you skip, just you, continue, and you're 28. We'll just say you're female. Can't be charged more for that. And you are not eligible for Medicare, Medicaid, CHIP. You are not legal parent or guardian. You are legal parent or guardian of a child under 19. You are not pregnant and you're not a tobacco user. Are any of those things true? Which I also think it's highway robbery. They're allowed to charge you more. Dean, why are you still... I mean, I'm delighted to have you here, but I have no idea why you were still up this late and just watching us try to get American health insurance. Okay, no spouse and no dependent. Okay, estimated 2022 income. Yeah. Dean is watching our dumpster fire over here. Or you're just here for the donut. Oh. All right. So 1,600. Yeah. 16,000. Okay. 16,000. Okay, so it says that you should get $458 per month as a subsidy, and your monthly premium should be $0. These were the options that it listed for you, but like I said, I want you to go for those silver plans whenever possible. So the silver plans are really great because look at this. You've got a $0 deductible, $0 monthly premium, and your out-of-pocket maximum is $2,000. So, if you want to look at what it covers, if there's any prescription drugs that we want to cover, and like I said, any contraceptives are covered without charge, so you don't even have to worry about that. But if you do have like a provider or anything that you want to look at, Dean says, lol, I wanted to live in the US one day. This plan might be changing as a result of this live stream. I'm sorry, but guns and healthcare are two of the hardest, gun violence, I should say, not the guns themselves, but the gun violence and healthcare are two of the hardest parts about that. It's giving me something so different. Why is that? What did I do wrong? Here's my recommendation for you. If you can stand it, make a totally new account on healthcare.gov. Like, I'm serious. Just make an entirely new account. You didn't do anything. You didn't do anything wrong. This website sucks. But I want you to, there are lots of options for you. It looks like, how many options did it give us? It gave us like 31 plans, and a ton of them are decent plans. So, Crystal Sky, I am totally going to do that. I made an account tonight. I don't know what's wrong. I hope this helped made you feel like better about the fact that we have solutions for you. So I don't get this one. I don't like this one. You got a higher deductible, higher premium, and like, look at that coinsurance. It's too high. There's good options in here though. And I would recommend getting a silver level plan because you're going to get a lower deductible and you're going to get like more assistance and stuff like that. Here's another thought I have. Open an incognito tab in Chrome. Like, wipe your cookies. So, Dean says, I'm hoping there's some kind of brokers, advisors one can employ to help because otherwise brain go fail. Actually, yes. So there is this thing called a healthcare navigator, and they are totally free people that can help you figure out what health insurance plans to enroll for. So if you are struggling with it, they actually increased funding with the American Rescue Plan last year for healthcare navigators, and they help you at no fee to you. For me, I have found the healthcare navigators to be, unfortunately, unless they really understand my specific needs as far as my drugs, they are not as helpful as I have wanted them to be. You can also work with brokers that do not charge you anything, either health insurance brokers. They get paid like a small commission. I don't like those either because then they have an incentive based on the commission of what to recommend for you. So, Crystal Sky, I hope you have a good option here. All right, we're going to eat this donut. This is a long live stream. We're already like 2 hours in because we're talking about health insurance. All right, here's the creme brulee donut. I'm sorry I can't get a better picture of it because it's truly gorgeous, but it also kind of looks maybe not beautiful on the camera, but the colors in person are great. It may have been under the studio lights a little too long because it's like pretty hard on the top. All right. Here's my time to quiz people. What exactly is creme brulee? I know that you like crack it, but what is it made of? I think it's cranberry creme brulee. This is worse than a dumpster fire about American healthcare. It's like a car wreck. You can't look away. I know, it's really sad. It's just cream, sugar, and eggs away. actually. It can be flavored though, right? Because this is like creme brulee flavored. Oh. Oh. Okay. So the inside is like pear with like some sort of berry juice, and it's gooey, and it was like the best bite ever. I'm trying to look up what the flavor of this is. This is so good. The texture was definitely better on the fluffer nutter, but this middle bite, oh, it's so good. It is a, what is it? It's a cranberry and bruleed pear. Okay, I got it very wrong. That was pear curd in the middle. Dean Schoen says, the navigators sound like the Citizens Advice Bureau here. If you get the right person, they're amazing. Otherwise, there's a lot of signposting. Yeah, like, some navigators are great. I really, really recommend the ones that are there to help a particular group. So, like, the ones that might be part of your university, the ones that might be part of, like, the queer healthcare clinic, particularly if you are trying to get access to PrEP or something like that. Those healthcare navigators that are for specific populations, if they're for people that live in your housing community or from your tribe, like, they're going to know a lot more of the situations. There's also a lot of navigators and experts that will help you figure out health insurance if you have a rare condition. So if you have something like cystic fibrosis or particular kinds of cancer, your patient advocacy group will usually have access to healthcare navigators that know more of the ins and outs of the drugs that you're on. This was amazing, but honestly, I could have just had the pear curd in the middle. Like, I didn't really need the donut part. So, like, 7 out of 5 for the pear curd, and then, like, 4 out of 5 or 3 out of 5 for the donut. I definitely do not have donut rating available. We barely got this live stream together. We did. Right? So there are specialized ones. That's super important. What's also important is they are free of charge. And they did not exist before the ACA. So, and as you saw, the website's terrible. And therefore, the advantage of this is that they navigate the website for you. So you can go to a navigator and have them help you, like, walk it through. Should we just be done, or should we do floof of the week before we leave? I'm also like, I will keep talking about health insurance till the cows come home. So if you've got more questions, if you just want to rant about it, I'm happy to do it. But we can also look at floof of the week here. It's really cute floof. It is pretty late in the floof game, but it's such a cute floof. I think that we probably need to do it regardless. Or we can completely avoid whatever I have to do, and instead of shopping for health insurance, we should try to shop for... we should try to shop for Lily needs a bag for her trip to Finland. Okay. All right, we're going to do floof. Floof of the week. I still don't have a floof of the week theme song. I really need one. Floof of the Week is where we celebrate the fluffy companions of the people that are part of the Personal Finance Society, which is our Patreon supporters. Link is down below. These are the people that give $1 or more per month to support Oh My Dollar forums, our workshops with low-income and transitional youth about finances, and our all of our transcripts and everything, and make it possible for this to happen. So thank you very much to the Personal Finance Society. And our treat is that we all get a look at this floof. So our floof of this week is Ruthie, who comes to us from H. Larson 86. Ruthie is an 11-year-old beagle who loves all foods and rolling on her back in the grass. She was adopted last New Year's Eve from a local shelter. Look at this beagle. Look at this beagle sound. Beagle sound. Look, so cute. Oh, and so tired. It's like the tiredest kitten. It's very cute. So yes, that is it. That's Ruthie. Look how cute she is. It's the face. I just want to boop it. Just boop. Little boop. 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 Gonna boop all the floofs. And then this very happy little toe beans. Little toe beans. Doop-a-boop. Thank you very much for supporting Oh My Dollar on Patreon, H. Larson, and thank you for sharing Ruthie with us. Completely 11 out of 10. Great floof. I know. Like this is the best possible place to be, right between the concrete and the grass. Iris Bear said she looks so happy. I think I have cranberry stuff on my face. It's great. I'm doing great. Well, anybody have any other questions, or should we let Ruthie play us out? Because it's been kind of a long, it's been kind of a long show. And y'all made it here from the other stream. I hope that no one was just like waiting on the other stream, wondering where we are. Trying desperately to make it over here. Oh, cool. There's 50 views on the other stream, so that's great. Oh, well. It's been lovely. We didn't want to mention it, lol. You know, I'm not sure it was my fault. I'm pretty sure the Chrome filter broke. The thing that displays comments, I'm pretty sure it broke. Craig says, good show. Thank you for the info. Well, thanks. I'm glad you felt like that was a good show and not just like you felt like we're in the fiery hell. I expected to touch a little bit more on like how exactly to choose a high deductible plan versus a low deductible. But a lot of it comes with like, do you have planned expenses? Like, you know how much you're going to spend, or do you mostly have insurance because you're worried about big future expenses? Both of which are totally valid. But if you're more concerned about big possible future expenses, like what if I get really sick, one of those things, then you can probably do a health savings account or something. Okay, all of my lights are shutting off because they are timing out. So this is the sign that we should wrap up for the evening. Iris Bear says, hey, you managed it at the end. Job well done. Yeah, I did have to kill the other stream, though, which I'm not like 100% positive that was the best thing to do. But, you know, sometimes it's just life. Sometimes it's life. I'll have to have some diagnosis happen later about what happened. So, all right. Well, y'all have a lovely week. Please pet some cats for me. We really do have a wonderful forum, wonderful Oh My Dollar forums, and we do have a healthcare Open Enrollment thread. So if you are running into the case of you have multiple options at work, we will help you puzzle through the different options. We also have link to a spreadsheet on there about how to walk through the different options. So we have helped multiple people figure out like what their different open enrollment issues are. So if you have any questions, please give me some answers. Or please let us give you some answers. I don't know, whatever. I'm tired. We're all tired. It's all time to go. Dean says, thanks for this. It helped me somewhat rethink my life plans. I knew it was complicated, but it is furiously complicated. That is good to know. Everything really is a mess in the US when it comes to healthcare. Yeah, it is both very complicated and very stressful because you don't really want to be without it, but at the same time, getting it seems really challenging. Crystal Sky says, thank you for the wonderful show and the help was great. I came for Hobonichi videos. I stayed for the great shows. Oh, that's such a delight. We will do our best to have another Hobonichi video at some point again. I need to update my planner, Graham, as well. But you will know that the instructions for how to get this live stream live were in my Hobonichi, despite failing miserably. So yeah. Well, thank you. Thank you for staying for the shows. All right, take care, everybody. Pet a floof, drink some water, stay hydrated, and I'll see you all next week, hopefully with less technical errors. Bye.